Okay, well, my interest goes back really into my childhood. I've always had an interest in about the mind and the potential of the mind. I can remember that at a very, very young age, that wanting to find out about how the mind works. And in school, there wasn't much emphasis on that. It's more about filling your mind with facts and information to get you through school. But at the same time, I started reading up books on psychology and philosophy from some of the more extreme ends of philosophy, the esoteric end and so on. And then I began to study disciplines like yoga, looking into martial arts, the internal side of it, looking at different kinds of religious, spiritual views, and then looking at conventional psychology, what it had to say about the mind. So out of all of that, I began to work with my own mind and then working with other people's. I was teaching yoga classes at quite an early age, still in my teens, and I noticed that with meditation, people could become much more relaxed, much happier then emotionally over time, and could get an insight into their own psyche. That led me to look further into the therapeutic applications, and I looked into psychotherapy, conventional psychotherapy. I've done several trainings in that, but most specifically hypnotherapy, because it's the most powerful way I know to go to the inner mind, to really connect with the inner mind and begin to release its potential. And that's where the problems are mostly coming from, the inner mind. They're not logical, they're not rational. These are emotionalized beliefs in people's minds that are very hard for them to shift, because often they're acquired early in life or in traumatic episodes, or we were saying not always trauma, meaning a loss of a limb or nearly a loss of life, but it is something that was very disturbing, a shock to the system perhaps. We could sometimes call them sensitizing events. So when you look into where people develop these negative fixed ideas, these emotionalized beliefs, they are from very severe sensitizing events. And then with hypnotherapy, instead of talking about it for years in psychotherapy and trying to bring closure that way, you can go into the subconscious level of the mind and re-educate those beliefs, re-educate the emotions and the intellectual responses even to those events. And so the person can bring real healing and real closure in a much more powerful and complete way and in a much shorter period of time. So that's given rise to the clinical work I do. In parallel with that, I still teach psychology and medical applications. I've been a medical psychologist for many years in the medical school, and I still teach on the neurology side of things, medical neurology, medical neuroscience. And so that's all part of my background, and it's a bit of a short summary of where my interests have come from, leading me to do what I do at the moment.
I wanted you to cover two more things a little bit in more details because you touched upon them, to try and understand what hypnosis is and what's the extreme levels of a good hypnotherapy practice can enable one to do, basically.
Yeah. Well, hypnosis is really a word used to describe a set of mental operations. I say at least, it's a phenomenon of the mind which has remarkable qualities. And these qualities and abilities that it releases within us give us great control over mind-body interactions. In the case of somebody who's skilled with self-hypnosis, or a skilled hypnotist doing it to somebody else, what we call a hypnotherapist. In the hypnotic state, or condition, or mood, or whatever you want to call it, because there's a lot of academic debate. Is it a special state? Is it not a state? Is it really just a combination of imagination, relaxation, very relaxed, deep concentration, and several other mental operations? Or is it a special, unique state of its own? Really, that doesn't concern most hypnotists. I would say it's interacting with our deep mind, the inner mind, the mind that we call the subconscious, and hypnosis is the process of induction, opening up the mind to get into that state, and then being able to work with the mind, with programming and so on, to change certain beliefs. Now, the thing about the hypnotic state itself is that it is a very natural state. It's an inborn ability we all possess. Of course, a hypnotist develops it to very advanced levels. if they're skilled, that is. When you get into hypnosis, it feels very much like a state of heightened awareness, heightened sensitivity and selectivity, but yet more relaxed. And you're not unconscious, you're not asleep. And that's a big confusion that exists still out there. Because when the state of being asleep or unconscious, you're not sure what's going on, and maybe somebody can control you. And so people have these misplaced fears about hypnosis based on misconceptions that it's a form of sleep. In hypnosis, there are a lot of changes going on in the brain, from alpha waves to theta waves. We don't have to get into all that here. There's greater ability to relax at a very special, extraordinary quality relaxation, which brings the mind-body into better harmony. We would call it move towards homeostatic equilibrium. There's much greater access to our innate imagination, the power of the mind for its creative abilities. So artists and people like that who use their minds for imagination and creativity, they're automatically entering into that state. People, as they relax in daydreaming, going into meditation, they're opening up the deeper mind as well. These are states associated with hypnosis. We sometimes call them hypnoidal state, or they're more of a full hypnosis. When we enjoy a good film at the cinema and we are immersed in the plot, in the whole drama, what's happening on the screen, we can lose awareness of where we're at, where we're physically sitting. And you're sitting watching a film, but if it's an exciting film, it engages you, and temporarily you're off in your imagination. So we all have this ability to go into our imagination, into that inner creative mind, and we can use it for all kinds of purposes. And we can take it to extraordinary levels, as you've just said, to control pain, to affect our blood pressure, heart rate, to begin to influence healing mechanisms, for example, to boost our immune system, or in a simple way, if you're very tired, to boost your energy, to help people who can't sleep, who have problems with insomnia. And when they learn through the hypnotic experience the quality of relaxation that's possible for them, insomnia is usually no longer a problem. Now, if they have some deeper issues, a person would have some problems from their past, deep traumas, deep disturbing events. We can reduce the psychic defenses with hypnosis and go and deal with those problems much more effectively and successfully and completely than if we were just to talk about them intellectually for years and years and years in therapy. So hypnosis has many aspects to it which are very complex, and we don't yet understand all about it. But this package, this whole experience, gives us that power, gives us that opening into the subconscious power of your mind to begin to use it as a force for good in your life, instead of it working against you. So you've asked a very big question. I've given a short answer, even if it seems long, because it's such a vast topic. We could be here for a very long time.
Sure. And I was smiling in some parts of it. It's because I relate to what you say. Now I've been through the course. I've been hypnotized. I've been practicing hypnosis for myself and already with friends and family.
Good.
And the results is just there. Like when you say with energy, you can learn to hypnotize yourself to increase your energy. I have IBS, so digestion problems. I can hypnotize myself using the tools that you taught me to visualize my digestion being better, etc. I won't go into details into all of that,
Great.
But slowly we will unravel all of these things which we learn there, and it works like magic. It's and there's no side effects, which is the beauty of it. So thank you so much for sharing that.
Okay, well, that course, which is called Hypnotherapy Skills for Life Change, is a foundation course for therapists. Usually they come in, learn that from that course how to induce hypnosis, what the hypnotic trance state is like, and they learn a lot of it through practical work, by going into a trance themselves, by working with other people. They learn about suggestion, they learn about how to do programming in depth and how to work with the simpler problems in stress management perhaps and performance enhancement, and help people with problems like smoking cessation and so on. So there are clinical skills that are learned. That course covers a great deal of information on the interactions that go on in hypnosis, that the language skills that are needed, which are about how to touch on the subconscious energy of the mind with the right use of language, working on logical and emotional levels of the brain through language skills, and working with nonverbal communication, working as well with a great range of induction methods so that you're not stuck with just one or two methods. You can adapt to meet the needs of the client. We teach the rapid inductions, instantaneous inductions. We are really the legacy of Gil Boyne's work, who was the seminal person with instantaneous inductions, the main developer of them in the Western world, starting back in the 1950s, which transformed the way stage hypnosis worked with those instant inductions. Now, we teach a wide range of methodologies for the trance state itself, but also how to use the trance. Now, that can be used then for learning self-hypnosis, personal discovery. You could learn a great deal about hypnosis for your own use, even if you had no intention of becoming a therapist. We've had people come on courses who thought, I'll learn this for my own use, and they've been so excited by it and so influenced by it and found how much it's helped them that they then decide, I'd like to do this as a profession, as a vocation.
That's me.
And I'm ready to move away from what I was doing before because this is so valuable. Or I'll use it in conjunction. I'm a physician, I want to use it along with that. And often they'll tell me over the years, I found this so valuable to my patients that I'm much less interested in giving them medications and sending them for surgery now. So, but it can be used as an adjunct to all kinds of therapies. Many of the people who worked with us in our training courses have been psychotherapists and counselors, but have been so inspired by the way hypnotherapy works with the deeper levels of the mind that they continue to use it within their own world of counseling psychotherapy, but essentially they're hypnotherapists now. We have people from all the performing arts in our classes, actors, we have the musicians, painters, sculptors, we have all kinds of people from the business world, we have people from every branch of medicine, from surgery to psychiatry, general practitioners, dentists. We have, like you say, philosophers, people who are clinical psychologists, other branches of psychology, and street hypnotists we've had.
Yeah.
And they all get on very well in the classroom, by the way, because they're learning about the human mind and they're going to learn about some of the most important fundamentals of the mind, and particularly those deeper levels of the mind we're calling the subconscious, and they're each going to take from it what they need that's most valuable to them for their work. And for example, let's just take a few of the people you've mentioned there, the psychologist. Well, psychology student will have learned a lot of theories, academic theories about the mind, and find he can now add hypnosis practical skills, which allow him to work with the mind, not just think about how it might work. He has direct connection with his own inner workings of his mind and can then learn to use that for later on working with other people as he becomes or she becomes a clinical psychologist or a counseling psychologist or some other form of applied psychology. Then we have the doctor who can learn to use it for helping people with their pain, where they've got chronic pain and the drugs no longer are adequately controlling it, but helping patients with stress, helping patients deal with depression, anxiety, and sometimes that's connected with their illnesses, their stigma and depression and fear about their condition. Psychosomatic illnesses generally, which are very much influenced by the mind, and a whole range of applications within medicine are now available for the doctor who's working with hypnosis. So on top of that, for the doctor's own personal use, where he or she may be stressed, burdened with the administration of medicine, financial demands if they're in private practice, dealing with interpersonal issues, dealing with your staff, dealing with your marriage problems maybe, dealing with your own stress and for your own job satisfaction and personal development in life. Everybody can learn something. Dentists would have many of the same goals as with the doctor. And the dentist is working with very stressed patients. People who have a great deal of anxiety often, or even phobia about dental procedures. Now he can relax those people. And that makes it less stressful for the dentist. He's going to become more fast, efficient in his work, more effective, successful. He's not struggling and stressed with a stressed patient to work with, which is very difficult sometimes. He or she will now become more, the throughput, as we call it, the patient is better. Financially, it's better. And at the end of the day, he doesn't feel as stressed, worn out, and job satisfaction is increased. And we add to that then anything else he can do to help patients with their behaviors, maybe educating a young person, programming them to look after their teeth better, to come for more visits, checkups, to help them give up on sugar, to brush their teeth more often, make changes that they need, maybe help them overcome bruxism, that terrible problem of grinding with the teeth. So for his own benefit and those of his patients, a dentist will get tremendous benefit. And of course, we're pretty famous in our world of medical and dental hypnosis. I've been on the television, unsolicited interviews over many years. They've come to approach me. I haven't done it through a PR agent or any of those people. I've just been asked many times about all the ways hypnosis can help a person with medical issues. And we've used it in surgeries for pain control, serious surgeries, more minor surgeries, helping them with recovery and healing, helping them deal with the anxiety beforehand and the stress of it, and reducing the need for chemical anesthetics. And in some cases where chemical anesthetics were not a realistic, practical option, they've been able to have the surgery with no anesthetic, if they're motivated and if they're willing to work towards that goal. And of course, we see now many women are taking up the use of hypnosis for childbirth.
Yeah.
So a great deal to offer there.
Okay. Thank you. Take care, guys.